do we have the resources we need in Peterborough? When you mentioned, you traveled all over the place helping folks elsewhere, but found a need to come back here to Peterborough, and I think we all agree that we've got an epidemic here. But what supports do we need in Peterborough? We've got your service, which is a company that's a business,
Right.
but we also have public service. But what else do we need here in Peterborough to help deal with this?
Well, I think that what we need is we all need to step back and see what the hell's going on and what is working and what isn't. And if somebody tells me something's working, I'd like to see what is, because we wouldn't be in this problem if there was. I think one of the biggest problems, at least in Peterborough, what I see, is many of the different organizations believe that the client themselves need to be empowered and that their offices will be opened, and if they need the service, they'll go to their office. I would argue that one will not come to your office if there isn't some initiation of a partnership or a relationship and a trust. If I have had a really trauma in my life and all those things, one of the big problems is trust, right? So how will I ever go to you to seek out help just because you have your door opened and you have an organization if I haven't built that relationship? So I think that is the start that we have to do, is start building better relationships. We have a city that believes in, not city, but people that believe that silos are good things, and that you have boundaries in those silos, you have those boundaries in this boundary type thing. I think it's the only city I've ever came across that believes that silos are good. Most places think we need to knock all the silos down, and I have to agree with that. And sort of because we need to cross the boundaries with each other to get to what needs to be.
So let me, just to clarify on that, so you would say like social services, mental health services, police services, city, county, are those the silos you're talking about? Or?
Yeah, well, if you look at the problem right now, the problem is a community problem, right? We have 30 deaths, that's just what we count that went to emerge, right? Mm-hmm. There's probably lots more deaths that there was never a postmortem to even decide how somebody died. So, yeah. And what does it matter if it was 1 or 30? We had people dying. And so one of the biggest problems is now you have first responders, so you have the police going to calls, you got the ambulance or paramedics going to the call, and then they go to emerge, then you have an overload in emerge, you have all those staff in emerge witnessing time day after day after day. They say there's up to 5 calls a day with overdoses right now. And then you have babies being born screeching in the nursery, and those nurses have to listen to that screeching. So that means you've got child welfare involved there because the children might have to be taken away. And then all of those frontline workers have to go home to their families. Mm-hmm. So this isn't just those people any longer. Our city, we've lost control.
What would be the ideal path for that individual who's been through all these silos? What ideally, Peggy, should happen?
Well, I think, there's been many of us talking about sort of a mentorship, and that's something that we're working on right now, where, somebody's working, and there's several places that want to do this, but, that there's a first connection with maybe 2 o'clock in the morning. You have organizations that are open from 9:30 in the morning till 5 o'clock at night, Monday to Friday. Addictions usually come out at 2 o'clock in the morning, and Saturday, maybe afternoon, and Sunday is the day that they want help. When I talked to my friend that's a manager in Emerge at the hospital, she said there are a group of people that really want to get help. And those are the people that I would like to start with, and then the ones that really, at that particular moment, whether it be 2 o'clock in the morning or 3 o'clock in the afternoon, that's the first time. If they ask for help, then you better have help ready for them. And then take them through an assessment, ask them what their plan should be, because it's their treatment, and then take them from there to a program, and then for aftercare. Aftercare is the most important, and that anybody that's going out of town for treatment, they're coming back with very poor aftercare.
So one of the things over the summer, I'm not going to say that not all people who have addiction issues are homeless, but a lot of people that are homeless in our community also have addiction issues. And I think, over the summer when Tent City was happening, you saw there was outreach from social services to get people in the park talking to people, trying to connect them with services. There's this by name list that's being developed that's meant to connect people with those services. So what would you like to see happen, once you have that list of people that, you find out, okay, these are the people in the community that need help managing their addictions because they can't get other parts of their lives kind of in order. They're not able to get secure housing, they're not able to work, they're not able to do anything until they start getting these things in order, and one of those things is addiction. So what would you like to see happen once the city knows that these people are out there and knows what they need?
Well, all of those things you just said, we've been fighting for 20 years, so they're not new, okay? What is new is we have fentanyl coming out of China that you do not need like land to grow poppies in anymore. You just need an email and it can be sent to you today in the mail, right? So we have a whole new mode of delivery, a new kind of drug that nobody was ready for, okay? So all of those things you just said, we've always had homeless. Sylvia could tell us that, she was the mayor of the city. We've always had these issues. What's different this time is the addiction. And it's this time that what our city has in the organizations that they're doing, either these people don't want to go to those organizations, or what they're using is not working. Most people in our city are either referred out of the city for programming or for residential treatment, which you might wait for 6 months. So if you want help on Sunday afternoon, you might get it 6 months. In 6 months, you might not want it then, right? And then the other one is methadone. So when methadone was started, because I remember I was a student at Trent then, and we had a fellow that needed, he was a heroin user, and we used to have to drive him to Oshawa. So we were happy to see that first methadone clinic open. But everybody's forgetting that the methadone clinics were opened for disease control, so that we would have not an increase in HIV and not an increase in hepatitis, right? You very seldom are hearing right now with all of this that you see needles all over the place. You're not seeing anybody talking about HIV and hepatitis. We're not talking any longer about disease control. And right now, this is a great time to be talking about disease control, right? We already are talking about that.
Yeah.
But so the whole thing, we continue chasing our tail, but this time we've lost control.